All right. All right. Hello. And let's go ahead and open up the doors to our Zoom room. Hello, everybody. Thank you for joining us here on Daily with Doc. My name is Becca Dukes. As the hostess of this program, I'm excited to be able to bring to you empowering information that allows you to be your own authority when it comes to health, giving you information, knowledge that you can be absolutely confident in knowing, because it makes sense that what you're putting in your body and what you aren't putting in your body affects how your body is going to either thank you or disgruntle you. So folks, welcome to Daily with Doc. You are going to be listening to information that is shared by a doctor who started out as a doctor of veterinary medicine, which when he was working to become a doctor of veterinary medicine, he was working in the pathology labs and made a great discovery that was just the beginning to the many, many things that he has done throughout his life in the pursuit to help restore, maintain, save the animal world, and then wanted to go even bigger and into the human world when he became a naturopathic doctor. And on that path, he got 3 postdoctorates in pathology. He also has, of course, a Bachelor of Science of Agriculture. I already mentioned Doctor of Veterinary Medicine, and then went on to become a naturopathic physician. So folks, if you were invited by somebody specific, make sure that you get back with them. They took the time and cared enough to share this program with you because they knew that you would find value in it based on you being somebody that's a health enthusiast, wanting to maintain that, or if you've got some things going on in your life, there's things other than chemicals to depend on, folks, when it comes to your health. You do not have to manage poor health. There is the opportunity to give the body what it was designed to need intentionally so that it can do as it was designed to function. And that's what you're going to hear more about today. If you are out on one of the live streams watching and you would like to join us live, you are more than welcome to do so. Go to dailywithdoczoom.com. That's dailywithdoczoom.com, and you'll be able to join us here in the live Zoom room. As we're in the Zoom room, the first part of the show, we're going to have Dr. Wallach giving a monologue. The second part is going to be questions and answers. So if you're here with us and you would like to ask a question, please go to that Zoom menu. Make sure that you look for reactions and raise hand and put your virtual hand up. If you're going like this, I'm not going to be able to see you. Sorry, I don't see all of the cameras. But if you raise your virtual hand, I will most definitely see you, and I'll be calling on people in the order that their hands were raised. Now, if you do happen to put in a question in the comments, whether you're here live with us or on the different platforms, please include male or female, age, weight and height, the major concern, and if there's any conditions that are controlled by pharmaceuticals. Because folks, just because something's controlled by a pharmaceutical does not mean that you or that person that you're asking for does not have that condition. And we're all about looking at the body as a whole, because nutrition is used throughout the body, not just in one particular place. So again, come and join us here in the live Zoom. And as a thank you to all of you for taking the time to join us, we would like to give you an extra little thanks for sharing this program with others. So if you go to dwdgiveaway.com, you can sign up and earn points that are going into a giveaway that I am offering this month for free product of what is mentioned in this program today. So go to dwdgiveaway.com and you will be able to share and have your sharing earn you points for an extra special thank you. Without further ado, I would like to bring to the screen with me Dr. Joel Wallach. Dr. Wallach, welcome to Daily with Doc. I know it's Monday, so you've had the whole weekend to study. What would you like to share with us today?
Well, I think probably we don't spend enough time talking about the heart.
Oh, very true.
So I think we should talk about the heart today. And the heart, of course, beats 24/7 your entire life. When you sleep, when you work, when you play, anytime you're alive, your heart's beating. If your heart stops, you're dead, okay? And you think about that little heart, the size of two fists, your chest, runs your life for your whole life, doing its job. Now, it's primarily, I'd say 98% muscle. And then there's connective tissue, kind of like tendons and ligaments, make up the
like the vessels and the arteries, the valves.
The valves, the valves and the valve stems and the what do you call it? The tendons that go from the valves to the muscles. When the heart beats, it contracts and it pulls that tendon and closes the valve. That's how it all works. Okay, and that goes on 24/7 for your entire life. Think about that. All right. Well, we just kind of watch the news. I watch the Fox News 2 or 3 times a day, trying to catch up what's going on in the world. And commonly per week, there's always 2 or 3 or 4 or 5 or 10 young people under the age of 30 they're perfectly healthy. They're athletes, have no history of heart disease, and they drop dead from a heart attack. Okay, they're 34, they're 24, 18, 12. And it used to be very common in babies. It was called a crib death, but it was also called sudden death syndrome. We're talking about babies who are a month old, 3 months old. And back in the old days, 100 years ago, plus, we're talking about sudden death syndrome took a toll on our population in America. America alone, each year, we would lose 2,400 to 3,700 babies dying of sudden death syndrome. Terrible, terrible, terrible. We're talking about 250 to 350 per month in America, babies dying of heart attacks. And that's because they didn't have the nutrients in the baby formulas. When the mothers were breastfeeding and the mothers were had a little leftover vitamins and minerals from prenatal days, they're taking those. The minerals and vitamins are going through the breast milk and going into the babies. But when the mother was working or whatever, and they're just giving infant formulas, Enfamil and Similac, they only had a couple of minerals in there, and it was sort of like maybe artificial milk, cow's milk, whatever, and so you don't know what was in it. And these kids were dying, and the doctors were blaming it on the mothers, saying the mothers laid on the baby and suffocated it. That's why the baby died. Many of those women committed suicide because their family just disowned them because the doctor said she killed her baby. Okay, so yeah, this was a mess going on. And in 1980s, my attorney, Jonathan Emord, and I, we sued the FDA. We sued the FDA in federal court to get these nutrients, these minerals put into baby formulas. We got tired of seeing these terrible, terrible statistics. And my mom sold her farm. I sold my farm to get the money to do that. 8 lawsuits against the FDA in federal court. We prevailed in every one of them. Thank you, Jonathan Emord. Within 90 days, suddenly now new cases of sudden death syndrome disappeared. Okay, because suddenly now these babies were getting these nutrients in their baby formulas. even if they were only having one dose a day of baby formula and the other 2 or 3 meals were breast milk. Okay. And so then you look around the world and you see people who are, they live a long time. And in the Bible goes back 3,000 years ago saying the people who lived a long time came from the lands flowing with milk and honey. Was it cow's milk? Was it horse milk? Was it goat's milk? No, it was glacial milk, where the glaciers would grind up the rocks, and this white powder from the ground up rocks would get into the streams coming down the mountains, and from a couple of miles away, it looked like milk coming down the side of the mountain. And Adam lived to be 930. Noah lived to be 950. Methuselah lived to be 969. And then there was many, many other followers of God who lived to be 800, 700, 600, 500, because they came from the lands flowing with milk and honey. All glacial milks are not the same. We have a book, Rare Earths and Cures, which is based on 1,700 autopsies that Milan and I did in China on kids under the age of 10 who are dying of these things. And chapter 10 is called Glacial Milk. And we have analyses, I don't know, maybe about a half a dozen different glacial milks. And you see they're quite variable. Some have 4 minerals, some have 40 minerals, some have 50 minerals, some have 75 minerals. When we started Young Judy, we looked very hard to find the best source of minerals. Of course, we found it, okay, in 3 or 4 places around the world, one of which was in the United States, and the others were found in the Himalayas, where the Huns live. Their life expectancy is 120. They don't have any medical doctors, but they live in the land flowing with milk and honey. We have the best medical doctors, just ask them. We have the most medical doctors per capita in the United States. And guess what? Our life expectancy, depending on where you live and whose data you're looking at, anywhere from 71 to 75. Well, 71 to 75 is not quite as good as 120. Okay. And so when you look at the glacial milk that the Huns are getting, many live to be 130, 140, 150, because they're getting those minerals. Now, what do we spend each year just to treat chronic heart disease? 316.8 billion, 316.8 billion. Okay. And let's see here. Then we look at high blood pressure, which is kind of related to heart disease and kidney disease. Okay, 131 billion. So now we're talking about $447 billion just to treat heart disease and high blood pressure. Okay. And kidney disease, which deals with blood pressure. Okay. We spend 24 billion to do just dialysis for treating kidney dialysis. Okay. And so we're looking at just about 500 million. It's like the second or third greatest cost to us is dealing with heart disease and heart deaths and so forth. And that's because nutrition does not occur equally throughout the crust of the earth. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And so when people live a long time, you want to know where they lived, what they ate. And one of my books is becoming very, very popular because we pointed this out. This book is called Hell's Kitchen. And this book goes through the transition between the use of wood and coal as fuel in our stoves and fireplaces and boilers and that kind of stuff. And we were putting the wood ashes and coal ashes into our gardens. And wood ashes and coal ashes are like 95% minerals and 2 or 3% carbon. Okay. Now, at 3 o'clock in the afternoon, you've heard me say this many times, at 3 o'clock in the afternoon, Monday, September 4th, 1882, we switched over to electricity. And within 18 years, by the year 1900, suddenly now we had over 50 new diseases nobody had ever seen before. They were just simple nutritional deficiencies because we weren't getting our minerals anymore from wood ashes, coal ashes. Suddenly now, using electricity, which was a boon for industry and manufacturing sort of thing, but it did give us the minerals we were getting when we were using wood and coal for fuel. And doctors would say, oh, don't waste your money on vitamins, minerals, just eat well, you get everything you need. That's absolutely, positively not true. Okay, plants do not make minerals. plants make vitamins, amino acids, fatty acids. They take the carbon dioxide out of the air and make carbon compounds, but they don't make minerals. And so the only way you're going to guarantee you're going to get everything you need every day and maximize your health and your life expectancy is to supplement with the 90 essential nutrients, which includes a minimum of 60 minerals. 2/3 of the 90 essential nutrients are minerals. Okay. And so that's why we have so many products that are based on minerals. We like our rebounder sports drink has 75 minerals in it. Red Bull, the biggest selling sports drink, only has one mineral, magnesium. We have 75 minerals. Okay. And so it's one of those things where you need to make sure, if you're a woman and you're still cycling and you're not planning on having a baby, but things do happen. Okay. So you want to make sure you're taking the 90 essential nutrients daily on a regular basis. So if pregnancy does occur, okay, and you might wait for one cycle to not appear, and I'm pregnant. So you run to the doctor and he gives you some prenatal vitamins. We're talking about like half a dozen vitamins and half a dozen minerals. You're not getting what you need, and certainly you're not getting what that embryo needs to manufacture all the various tissues and functions and systems and so forth. And so this is why we have problems. These birth defects are not genetic. They're not autoimmune. They're simple nutritional deficiencies because somebody messed up somewhere. Okay, it's that simple. And this is why we have education, why we have the books. Okay, and we have this flip chart coming out. It's 73 pages. I think Rebecca got the first one. It's a sample. So we're going to go through that and make sure everything's okay. And this is going to go along with the Wallach revolution, 75 years of figuring all this out. Okay, for over 600 different diseases. And we have both in the flip chart and this book, the Wallach revolution, many famous stories of many famous people who had terrible diseases, which we were able to reverse with nutritional supplementation, proper diets, and so forth. So we're very excited about this because this is going to take America and the world to a different level. Information will take us to a greater level of health and longevity. There's no reason why we can't live to be 120 like the Hunses, but it's got to be a priority. Okay. You say, well, I'll exercise. Well, if you exercise, you're sweating, and sweat is not just water, and just rehydrating with expensive water, okay, doesn't cut it. Okay, because you're sweating out a soup that contains all these vitamins and minerals as well as the water. And if you're just taking in water after you exercise to rehydrate, you're in trouble. And if you're pregnant, you're in trouble, and the embryo's in trouble. So with all that said, I'm going to pass this over to Becca. Oh, don't hear you, Becca. Don't hear you.
Okay, all you have to say is don't hear you, Becca. I'll hear you. Thank you. So that your monologue this morning leads right into my first question that I have that's coming in from YouTube. And Al is asking, how much of the father's health contributes in birth defects? If he's 36 years old, refuses to be on the program, although he has symptoms of nutritional deficiencies like gray hair, headaches, digestive problems, behavioral problems, stigma, hair dandruff. He had alopecia once in his beard, but it's gone now. The wife, who's 42, is in the program for 4 months now or more. Now, if she gets pregnant, can she still have a healthy baby?
Okay. You need both parents to be healthy and taking the 90 essential nutrients. Okay. The sperm is 50% of the baby. Okay. And so when you start out and there's a problem, and that 50%, the baby's going to have a problem. Okay. And so it's not just the mother. The mother comes in, if she's going to be breastfeeding the baby, the father can give the same bottle milk to the baby okay, the milk formulas that the mother's doing. Okay, so he can provide good, healthy nutrition to the baby after the baby's born. But it's one of those things where the conception and the development of the embryo required both to start out with, and then of course, after the embryo has started, the mother takes a greater role, not a total role, but a greater role than the father.
All right. So, I mean, there's a great possibility, because what she's putting into her body is what's giving those cells what they need to multiply. But it's best if you have healthy parts going into it, right?
Yeah, because
The egg and the
want,
sperm.
you don't want to just multiply, but you want to multiply healthy cells.
Mhm.
Okay. And you want to, when you have healthy cells, you're going to have healthy organs and healthy systems. If you're missing one nutrient, it could be catastrophic to the embryo. If you're just missing one nutrient, it could be catastrophic to the embryo. So it's not like, well, come see, come saw. No. Okay. We learned this in the agricultural industry, and that's why we don't have to have health insurance for animals. Okay. There's a variety of reasons, but one of which is both the bull and the cows, and of course the ram and the ewes, so forth, and the boar and the pig, the sow. They're getting all the nutrients they need and whatever might be needed by the embryos, because farmers don't have health insurance to pay for birth defects like they do in humans. Now, if humans had to pay for all the problems of birth defects out of their own pocket instead of insurance, guess what? Birth defects would disappear.
Well, they might take note of what they can do on their own without being dependent of chemicals or a doctor just giving them a pill for this or that. So maybe that's what we need, Doc. Because I know whenever I found your program, I didn't have insurance and I was still having to go to the doctor, and I was forking out a lot of money for them to tell me, well, there's nothing more we can do. All we can do is send you to pain management. Well, my monthly program with you costs less than what 2 doctor's appointments a week was costing me. And I was going 2, 3, sometimes 4 times a week to the doctor. So,
Wow.
folks, being dependent on insurance is not the answer. Take it upon yourself to really look into and open your mind to what nutrition can actually do within your body. So I do want to make sure that I mention here that the FDA does require us to let you know that this program is for educational purposes only. It is not meant to take the place of your primary care physician, nor are the products mentioned for use in diagnosing, treating, or preventing any disease. But folks, it only makes sense that when you give the body what it needs, and the way that we know what it needs is through Dr. Wallach's decades of work as a pathologist, where he saw within the individuals on his autopsy table, both mammals in the animal world and in the human world, that when there were deficiencies, there were disease, or vice versa. Where there was disease, there were specific nutritional deficiencies. And he plotted it all out, put it into a book, many books, actually, over 24, working on 25. Actually, 26 is in the making too. This man is not stopping, folks, because as he has done so much in his life, we want to make sure that we get it out in the book so that it helps all of us, because that's exactly where God put him on this earth, is to be a leader of a crusade in the importance of the 90 essential nutrients, plus some, if you've already got decline going on. Well, Dr. Wallach, let's go to the next hand that is up, or to the first hand that is up. And we have Sherry. Sherry, go ahead and unmute yourself.
Thank you very much. We have several questions from our listening audience. The first is from a 22-year-old male. Name is Josh. He's 6'2", weighs 210 pounds. He has been struggling with Tourette's syndrome for most of his life. He has a mild case. Some of his symptoms include blinking, coughing, talking out loud to himself. He's not on any medication. There was a drug I think he's considering, and that's guanfacine. I looked that up, and it treats high blood pressure by decreasing heart rate. Side effects may include collapsing seizure, blurry visions, and difficulty breathing. Is there something we can do for him?
Sure. Okay. He needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, oats, no buckwheat. There's no gluten in buckwheat, but has phagopyrenes, which are 10 times worse than gluten. No sugar, no carbonated drinks. Even the diet drinks got to go, and carbonated water need to go because they neutralize stomach acid, so you cannot absorb minerals or digest food. Then at 200 pounds, he needs to take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month, the full dose of everything twice a day. He needs 2 bottles a month of our MSM, so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone breaks bone itself, including the skull. Okay. And then I want him to have also to maximize blood circulation through the brain, okay, and the heart and every place else. He needs the Ultimate Daily Classic tablets, 2 bottles a month there, so he can take 3 twice a day. It's going to support healthy blood flow through blocked arteries, okay, in the brain and the heart and the kidneys and liver and so forth, lungs. He also needs the Synaptive, 3 of those twice a day. That's 2 bottles a month, and our I-26, 3 servings a day. Now, when you get anything going on with the brain and the vascular system, including the heart and the brain and the spinal cord and that kind of stuff, you need to make sure you're getting everything. Okay. There can be no, well, I'm just going to take a lot of vitamin C. That's not going to work. Okay. Need to be taking everything. And this is why the formulas to the average person seem kind of, what should I say, complicated. They're not complicated when you understand that each tissue, each cell, each organ, each system requires all these things to function properly. And if you give your body what it needs, you'll add many, many, many healthful years, okay, to your life. Many, many healthful years to your life. And so all of these various syndromes are easily prevented and easily reversed, including Tourette's syndrome, just by getting rid of the bad stuff and doing all the good stuff. Okay, so keep us informed. Call us every week or 10 days or 2 weeks, whatever is convenient. It's toll free, so it's not like it's going to cost you any money to give us a call. Okay, and we don't charge anything for our time. And so it's one of those things where we'll be happy to help tweak, okay, their symptoms.
Thank you so much. We have one other questioner from our listeners. Teresa, 60, female, 140 pounds. She had ECT. I looked that up. It's electroconvulsive therapy, a medical procedure that involves passing a mild electric current through your brain, causing a short seizure. She had it for depression. Last year, she was diagnosed with first stage Alzheimer's. 2015, she had open heart surgery for mitral valve repair. She lost 50% of her energy. Can we help?
Sure. We don't have a weight.
Yes, 140.
140, okay. All right. Well, again, none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, barley, rye, oats, no buckwheat, no sugar, no carbonated drinks, even the diet drinks and the carbonated water needs to go. And then at 140 pounds, that's about what I weigh. I want her to have 2 healthy brain and heart packs a month. 2 healthy brain and heart packs a month. Full dose of everything twice a day. She needs 2 bottles a month of the MSM. She can take 3 at breakfast, 3 at lunch, 3 at dinner time. Then she needs 2 of the containers of the collagen peptides. She can take a scoop of that with her morning drink, scoop with her evening drink. And then I want her to have our synaptive, 3 of those twice a day, so the brain cells can talk to each other and be kind to each other, and the brain cells can talk to the spinal cord can talk to the brain. Also, she needs the I-26. 3 servings a day, the I-26. I do that. I like the chewables. They come in the vanilla ice cream or the banana coconut and the chewables. Then we do have the capsules. We do have the powder. And so this is the direction she needs to go. Also, the rebound or sports drink for energy. Okay. And wouldn't hurt because she has heart issues. Wouldn't hurt also to throw in the Ultimate Daily Classic tablets 3 twice a day. That's 2 bottles a month. So she can get blood circulation into the brain, into the heart, into the kidneys. And so it's going to deal with the kidneys issues as well as the heart issues. Okay.
Thank you so much.
You bet. Keep us informed every couple of weeks and we can, tweak this as we go along here.
All right. Thank you so much, Sherry. And Dr. Wallach, we have an email that came in from Irene, and Irene's actually on with us today. She said she just got some blood work. She's 71 years old, 5'5", 140 pounds, cholesterol 280. It was at 233, with HDL of 68, LDL of 184. She has been taking the 90 essential nutrients and the secret sauces, but she needs some more advice. They are telling her that she's on the verge of being diabetic. So Dr. Wallach, what would you recommend for Irene?
Okay, so she's a pre-diabetic. Okay.
That's what they're telling her.
Okay. All right. So she needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, bran, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go and carbonated water got to go. And then 2 healthy brain and heart packs a month, a full dose of everything twice a day. 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone, makes the bone itself. Then, let's see here. Because she's a pre-diabetic, I want her to get 2 bottles a month of our sweeties, so you can take 3 at breakfast, 3 at dinner time. If she's on medication for blood sugar, don't cold turkey off of that. But as the blood sugar begins to drop, she can slowly reduce the amount of medication she's taken based on the numbers. Okay. And let's see here. Did she have anything going on with the heart or blood pressure, or kidneys, anything like that?
No, nothing noted, Dr. Wallach.
Okay, well, let's go with that. And if she wants energy, she can use our rebound sports drink again. And then give us a call every couple of weeks, toll free. And, we'll walk her through this.
All right, thank you. And one more email that has come in. We want to make sure that we don't forget them either. Is great, or Gary rather, writes in, he says, my mom had diastolic heart failure where her heart doesn't relax as it should. She retains fluid if she walks too long. How can this be helped? She is 72 years old, 182 pounds at 5'4", Dr. Wallach.
Okay, so she's got heart failure, right?
Yes, diastolic heart failure.
Okay. Does she have anything like a diabetes or high blood pressure?
Nothing noted.
Okay. All right. So again, get rid of all the bad stuff. I won't repeat it because we've said it 3 times now, so you should have that. Okay. Get rid of all the bad things. And then get her on at 182 pounds.
Yes.
Okay, I want her to have 2 healthy brain and heart packs a month, 2 healthy brain and heart packs a month, full of everything twice a day, 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner. I want her to have, let's see here, 2 bottles a month of the collagen peptides. You can take a scoop of that with her morning drink, scoop with her evening drink, 2 bottles a month of the Ultimate Daily Classic tablets, so she can take 3 at breakfast and 3 at dinner time to support healthy blood flow through the blood vessels of the brain and the heart and the kidneys. But I also, because she has heart failure, now that's very, very specific diagnosed heart failure, okay? Sometimes it's also called congestive heart disease, okay, when you have heart failure. I want her to have our de-stress capsules. I want her to have 3 of those 3 times a day, because that particular nutrient, specifically when you're deficient in it, causes heart failure. Okay, so she needs the de-stress capsules, 3 times a day. They're big bottles, so maybe 2 bottles a month will do it. Okay, de-stress capsules. But that's not by itself. That's got to be taken with all the other stuff. So she's getting the 90 essential nutrients, and they all kind of work together. The heart requires, and remember, is working 24/7 your entire life, never takes a day off, never takes an hour off. And so we have to be sure that we're taking very, very good of that heart. And that's why we came up with that de-stress product, because I had so many patients with congestive heart failure and heart failure of all kinds. And so we came out with that program. It's called de-stress. But again, remember, that is a secret sauce that goes along with the entire program. It's not to be taken by itself.
Absolutely. All right. Thank you so much for that, Dr. Wallach. Let's go to the next hand that is up. And again, folks, if somebody referred you to this program, make sure that you get back to them. Thank them for taking the time and caring enough about you to share this information. And also, if you are experiencing something that is similar to what you're being heard or what is being heard on this program, tell the person that shared this program with you, hey, on this program, they were talking about this. I'm experiencing this, or somebody that I know is experiencing some similar situations. Can you help me get what Dr. Wallach has recommended? Chances are the person that shared this program with you can absolutely help you or get you in contact with their coach or a coach that can help you. If there's nobody to thank, you are more than welcome to go to our website, as this program is being sponsored by dailywithdoc.com. We have a contact us, including the store that is there on the website. But again, that's for people who have never spoken to anybody about anything related to Dr. Wallach, longevity, or any of their products. And again, if you've never spoken with anybody and you would like to speak with somebody, we do have a team of health coaches standing by at 855-949-3377. All right, Dr. Wallach, let's go to the next hand that is up. And Greg, go ahead and unmute yourself.
Okay, I'm having a little trouble with my audio and hearing, so I don't know if you guys can hear me or not.
We can hear you now.
You can hear me?
Yes, sir.
Okay, cool. I have a female, age 68, 140 pounds, just was diagnosed with ALS. What can we do for her?
Okay, ALS, amyotrophic lateral sclerosis. It's also known as Lou Gehrig's disease. And it's one of the family of deficiencies of myelin, the white matter in the brain. We're talking about Alzheimer's disease, MS, multiple sclerosis, Guillain-Barré syndrome, which is multiple sclerosis, spinal cord, Parkinson's disease, FTD, frontal temporal dementia. You can see here, ALS we just talked about here. Okay, Creutzfeldt-Jacobs disease, which is mad cow disease. Okay, all of these are caused by deficiencies of myelin. It's just different locations of the brain are more severely affected, so you get different symptoms. Just like when you have arthritis, you can have arthritis in every joint in your body, or you can have, but it's more prominent in one particular joint, because, for instance, on the right side for the hip and the knee and the ankle, drivers of heavy equipment, they use that right leg for brakes and clutches and gas pedals and everything like that. And so when they get arthritis, they tend to have arthritis for symptoms noticed by them in their right leg, because that's where they do all their work. Okay, so She needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, bran, rye, and oats, no buckwheat. There's no gluten in buckwheat, but it does contain the phagopyrines, which are 10 times worse. No sugar, no carbonated drinks. Even the diet drinks got to go, and also the carbonated water. And then we want her to have 2 healthy brain and heart packs per month, a full dose of everything twice a day, 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. 2 of the containers of the collagen peptides. So you can take a scoop of that with their morning drinks or the evening drink. And then I want her to have the let's see here, the synaptive. Take 3 of those twice a day. It'd be 2 bottles a month, so the brain cells can talk to each other. I also want her to have 3 doses a day of our let's see here, of the I-26. It says right on the label, gives you 25% of your daily requirement of cholesterol. Cholesterol is required by your brain to maintain itself, particularly the myelin. The myelin is made up of 25 to 50% of cholesterol, depending on what part of the brain and spinal cord you're talking about. And doctors say, oh, stay away from cholesterol. I'll give you some statin drugs to lower your cholesterol. And they do that, and doctors create a lot of these issues by lowering your cholesterol. Cholesterol's good, you just can't fry it, okay? Okay, and so ALS, like, again, Alzheimer's disease, MS, Parkinson's disease, FTD, Creutzfeldt, Jacob's disease, ALS, Lou Gehrig's disease, they're all the same pathology, just like arthritis. No matter what joint it's in, no matter what part of your body it's in, it's the same pathology. Okay, so I hope that helps you out there, Greg.
Yeah, that's great, Doc. But I guess the first thing, we have to make sure that they're not on statins, right?
That's right. Because if they're on statins, and you're not going to be able to help them.
Okay. All right. Thanks so much, Doc. Appreciate your time.
Hey, you bet.
Let's move right over to AJ, Dr. Wallach. AJ, go ahead and unmute yourself.
Hello, AJ.
Hello, Dr. Wallach. How are you today?
Okay, sir. What can we help you with?
Timothy is 65 years old. He weighs 270 pounds and he's about 5'10", 5'11". He was in a car accident many years ago and has had some lingering effects. His concerns that he's asking about today is his heart issue. He had a heart attack a long time ago. ED, diabetes. He mentions that he does not get up at night to go to the bathroom, but does experience tinnitus and balance problems. And he's concerned about sleep apnea.
Okay. Yeah, he's got a lot going on there. And so this guy needs to get rid of all the bad stuff. Okay. And at 270 pounds, he needs 2 healthy brain and heart packs a month, full dose thing twice a day. He needs 2 of the bottles of MSM per month. So he can take 3 at breakfast, 3 at lunch, 3 at dinner. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone himself. He needs 2 of the canisters of the collagen peptides. He can take a scoop of that with his morning drinks or the evening drink. I would also have him take the Ultimate Daily Classic tablets. Take 3 of those 3 times a day because he's a big fellow. 3 times a day, the Ultimate Daily Classic tablets to support healthy blood pressure and healthy blood flow through the brain, the heart, the kidneys, and all that kind of stuff. Let's see here. For the diabetes, he needs the Sweeties. He can take 3 of those at breakfast, lunch, and dinner. That'll be 3 bottles a month. They're small, little bottles. Okay. And don't cold turkey off his medication, but as the blood sugar begins to drop, he can slowly reduce medication based on the numbers. And then for the ED, erectile dysfunction, we do have the, let's see here, the XERA test, XERA-test. Okay. He can take 2 or 3 of those twice a day, and they will give his Sertoli cells, okay, and his testicles what they need to make more testosterone. Okay. And he also needs the I-26. He needs the cholesterol to make the testosterone. With these sexual hormones for both males and females are 95% cholesterol. Okay, so they need a lot. They need a lot of cholesterol to be able to make these sex hormones. Okay, but all his problems we're able to deal with them. At 5'11", you know, close to 6 foot tall, you know, he should weigh about 210, maybe something like that. So if he wants to lose some weight, we do have the Fit Shake. We've switched now to the Fit Shake, FIT Shake, one a day. It's not to be added to a meal. It's a meal replacer, and he will lose half a pound to 2 pounds a day. Okay, so he may want to be on that Fit Shake for maybe 2 or 3 or 4 or 5 months, depending on, you know, how it's working for him. And so then give us a call every couple of weeks, and we'll walk him through all this. But all this is easily dealt with.
You're the best, Doc.
Oh, well, you're very kind. Thank you, AJ.
All right, Dr. Wallach, let's go right over to Teresa. Teresa, go ahead and unmute yourself. You're on with Dr. Wallach. Try again. Try to unmute yourself again. There you go.
Okay, thank you. I just want to thank you for having this program. I'm trying not to cry because you're speaking what I need to hear.
Thank you so much.
Thank you. God bless you. So you already answered my question about my health, but this is about my cat. If you could help with that, he's 8 years old. So he has a chronic scratching, and he's got scabs all over his body since last November, and he's lost most of his coat. I don't know what to give him anymore.
Okay, what are you feeding him?
Tuna. It's the wild caught from Costco.
Okay, stop. He needs a good brand of cat food with all the vitamins and minerals in it. Can't just give him a piece of fish. Okay. He needs a good brand of canned cat. I like the canned cat food, and read the label. It'll have a big list of vitamins and minerals. Also, he needs the Arthrodex. And at 8 pounds, I want him to have a half a scoop of the Arthrodex every day with his food. He'll love it because it has fish livers in there. So he'll say, oh, there's something I'm familiar with. Okay. Just give him fish fillets. That's like just giving you a slice of bacon every day for your food.
Okay.
Okay, you got to, yeah, you got to go with vitamins and minerals, and of course, again, a half a scoop of the Arthrodex per day. But the main part of his food has to be a good brand of canned cat food with the vitamins and minerals in it. Okay.
Okay, will do. Thank you.
Hey, God bless. Thank you for loving your pet. They're part of the family.
Oh. Thank you. God bless you.
Awesome. Thank you, Teresa. Let's go right over to Ryan. Ryan, go ahead and unmute yourself.
Hi, Dr. Wallach. I'm 29 years old, 127 pounds.
Okay,
5'6".
Slow down, Ryan.
See, you say you weigh how much?
127.
Okay, and how old are you?
29.
Okay, how can we help you?
I am having crunchy, squishy, clicking joints since a few weeks ago, and it's beginning to hurt. Also, chronically losing flesh and weight. My hair analysis from June shows that I'm low on copper, manganese, and sulfur. So, and I'm not taking any bad foods. I eat 2 meals a day. I don't eat carbohydrates, no buckwheat, oatmeal, beans, rice, wheat. I don't take metformin or medications to lower my blood sugar. I take 1 Sweet Ease and 400 micrograms of chromium picolinate before each meal. So I was just wondering, what should I take regarding my chronic?
You should have some carbohydrates, okay? Whether it's potatoes or carrots or stuff like that. You need some rice is good. You do need some carbohydrates. Okay, also, 127 pounds. I want you to take 2 healthy brain and heart packs per month, full dose setting twice a day. I want you to take, let's see here. I want you to take 2 vials a month of the MSM. So you take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, you're talking about the joints. Also, the collagen peptides, 2 of those canisters per month, a scoop twice a day with your meals. that, one at breakfast, one at dinner time, and they're going to, again, support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc, vertebrae, bone, makes bone itself. Then, once you also have the, let's see here, I like the Zera test, okay, which will help you with male hormones and all that kind of stuff. You need to take 3 of those twice a day. Okay, that'll be 2 bottles a month or small bottles. And then, let's see here. I shouldn't say that they're not small bottles. To me, they look small, but they're okay. But they're glass bottles, okay. And let's see here. Let's go that direction. And I do want you to have some animal protein. You can have fish, and not fried, steamed, okay, but you still have to have all this other stuff, okay. You can't just eat fish and vegetables. That's not enough. You do need to take the 90 essential nutrients, and it wouldn't hurt, again, that Zera test, TEST, like testosterone. And it wouldn't hurt to throw in the I-26. I like the chewables, but they do come in capsules and powder, whichever fits your interest. Okay, so let's go there, and then give us a call every couple of weeks, and we'll walk you.
Dr. Wallach.
Yes.
Sorry to interrupt. I was wondering, how can I increase my manganese and also my zinc copper ratio? Like the zinc is very, very high.
I missed the first part. You said, how can I?
I have low manganese, and also my zinc copper ratio is very high.
Well, your 2 healthy brain and heart packs and your 2 bottles of the MSM are going to give you all that.
The Zera test has a lot of zinc.
Yes.
So wouldn't it aggravate the zinc issue?
No.
Regarding the manganese, what else should I take? Because I don't see any manganese inside the healthy brain and heart pack.
Oh, you need to read the label again.
Okay.
And
Yeah,
also,
it's in there.
it's in there. Yeah.
All right. Thank you, Ryan. And Dr. Wallach, I know it's time for you to go. There was another question, and I know we don't always get to the questions. So folks, please go to dailywithdoc.com and send us a message letting us know what your questions are, because we want to make sure that you are getting the answers that you deserve. Okay. So please go to dailywithdoc.com, use that contact us, or better yet, subscribe to our newsletter. And as you are subscribing to our newsletter, there's an option there to submit your questions in the comment. Our newsletter right now, as we're sending it out, is giving you links to our previous week's programming and descriptions of what each program was about. So that helps you to be able to find the program that you listened to, that maybe had the information that you're looking for because you asked a question yourself. But it also makes it easier to share with people who may be experiencing some of the symptoms that were mentioned on that show. So please sign up for the newsletter at dailywithdoc.com. This is for everybody. And don't forget, we do have the giveaway that is going on. Go to dwdgiveaway.com. And as you are sharing this program, you are earning points that then puts you into the runnings for giveaways that I will be offering. So if I could get my co-hosts up with me, that would be absolutely fantastic. I apologize again that we didn't get to all of the questions that were on the show today. I just want to do a special thank you and shout out to my co-hosts. I would not be able to do this without them. There are so many different things going on with questions coming in from the different platforms, which is how when the co-host comes on and asks a question, they're fielding those questions from the different areas. I want to thank Ruth Ellen Sanchez for being my executive production manager and helping me get this all put together and organized and make sure everything is going where it's supposed to be. I want to thank her assistant, AJ, the assistant executive producer, who is very instrumental and always go, go, go in getting out on the different platforms and answering those questions and getting the questions brought into the Zoom. And also getting the program itself out on so many different platforms. So if you're out watching on any of the platforms, make sure you put in the comment that you are watching either the live stream or the repeat, and let us know that you are out there and what you liked best about the program. I also want to thank Albert. Yesterday he was last, so today he's going to be more towards the front, for being here all the way from South Africa during a time that most of us would be sleeping if we were in that time zone, for helping let people into the meeting and also watching the comments and the videos also to make sure that it's a safe place for everybody. I want to thank Sherry for doing the same and making sure that the questions that are being asked in the chat are getting addressed and letting people in and monitoring those cameras. And also, I mean, all of us are kind of monitoring cameras. Phyllis doing the same and bringing in those questions and answering questions also. Her and Marilyn do some amazing work in this chat, folks. So if you ever have the opportunity of joining us in a live Zoom, make sure that you have that chat option open. Marilyn is putting in dictation, and when Marilyn's not here, Phyllis is putting in the dictation of what Dr. Wallach is mentioning, and both of them are putting information in that chat that just helps to give you even more knowledge and direction on how to find answers that help you make that decision about your own health. So as a team, and then I saw we have Coach Rod, he's out there also doing some communications within the chat of the different platforms. Folks, we have a passion for health. We have a passion for people. And when you take those passions and you put them together, you have purpose when becoming a health coach. And as a health coach, we then are sharing a message, sharing our own testimonials and stories with people that help them see that there is hope. There is possibilities in their own health, that they don't have to be stuck. Of course, everybody's different. Everybody's digestive system is going to accept the nutrients faster or slower. But when you give the body what it actually needs, the body itself can do some amazing things. We invite you to give Dr. Wallach and his recommendations 90 days. Get back with the person that shared this program with you. If there is nobody to thank, feel free to go to dailywithdoc.com, reach out to us there through the contact option. If you know exactly what you are looking for, because Dr. Wallach just told you, we have a store there that has all the products Dr. Wallach mentioned as well. And if you're still not quite sure and you would like some assistance in ordering and you've never ordered before or spoken to anybody before, we have an amazing call team at 855-949-3377. Again, my name is Becca Dukes, as the leader of this team, hostess of this program, and also the Director of Student Services with the Institute of Holistic Health. We invite you to join us on this crusade. You can go to Coach with Doc, that's D-O-C, coachwithdoc.com, get some more information about our Certified Holistic Health Coach course, and also to sign up, as we now have a payment plan also to make it more affordable for people to get the information they need, that then is an investment into them being able to help others, which helping others then is putting money back in your pocket, folks. So until next time, bye for now.